Guys, Russel Williams here at the Y Factor, and let's talk a little bit about what has affected our lives quite a bit throughout 2020 and 2021, and that is COVID. So, we get a lot of guys that come in, and a lot of guys are really interested in knowing to what degree COVID exposure or active symptomatic COVID infection might have affected their reproductive capabilities. And so what we are beginning to see some of the information come out from some of the studies, and unfortunately these were studies that were done on people who actually died from COVID. So they're able to look at an autopsy specimen to see to what degree COVID has been able to affect the testicles. And some important findings came about, and that is that they see that COVID and the virus, the coronavirus, is able to get into the testicles, and that there are quite a few of the ACE receptors that are the entry mode into cells present within the testicle. And so they're able to see quite a bit of inflammation. They're able to see that the virus actually has the capability of affecting mainly sperm production, but not so much testosterone production. When they went back and took a look at some of the guys who had the COVID infections, they didn't all complain of testicular pain. So it could be a relatively asymptomatic finding that's present that would not normally be quite notable on history. Then they went on and took a look on guys that had produced an ejaculate sample, and they were able to find coronavirus in the ejaculated sample. Now, what's also very important is that there's never been, as of 2021, a documented transmission of the virus through sexual activity being transmitted through the semen sample. A couple of other interesting findings is that it could be up to 3 to 4 months before some of the effects of the inflammation is reversed from the COVID infection. So we're quite aware of the condition. We look for that in guys who have a sudden drop in their semen parameters, especially if they had a recent seroconversion to COVID positive. So hopefully COVID has not been a part of your life, but if it has, or if you have concerns about the possibility that COVID has affected you, come in and see us. My team can evaluate you, and we can do a semen analysis, and we can evaluate your fertility.